Hi everyone, my name is Dr. Fausto Ramos, and I want to talk to you today about what a bunion is and how we treat bunions. Most of you probably already know what a bunion is and what it looks like. Many times patients will have pain on the inside aspect of the foot. Let me show you a picture of what a bunion looks like. Okay, right here, as you can see, a bunion. This is a bunion. It's a curvature. It's an increased exostosis, we call it, an increased bump on the medial side of the foot. And that many times gets irritated when you use shoes and when walking. So there are different ways of treating this. Classically, we use an open procedure where we go in, we cut the bone, we slide it, and we put a couple of hardware screws or maybe a plate in there in order to fix it and to realign the joint. And that's the traditional way of doing surgery. You can probably see in this other picture some of the hardware that we use in order to fix the bunions. Something like this, or we'll use a couple of screws like this also. But now there's also new techniques that we do and that we use in order to fix the bunions. And this is what I'm specializing in. This is what I'm specializing in. Our practice is dedicated to fixing bunions in what's called a minimally invasive technique. So the way we perform this technique is through, and how we fix the bunions is through little tiny incisions in the bone. And for that, we use, in my office, we have a surgical suite dedicated for that purpose of fixing the bunion with minimally invasive technique. And the good thing about this, as the name implies, it's fixing the bunion with tiny incisions, minimal incisions. And the good thing about it is that you barely see a scar. You don't have to open the foot or the area completely. You don't have to put a lot of stitches because you're using a very tiny incisions in order to fix it. And the correction is awesome. The correction is great. You can get excellent results with it. One of the benefits that I tell my patients of doing minimally invasive bunion surgery in the convenience of an office surgical suite as opposed to the hospital setting or at the surgery center is that many times it's somewhat more economical. Many times if you go to the big hospitals or if you go and have it done at the surgery center, you have to pay some extra fee. Doing it in the convenience of a surgical suite in a doctor's office setting is economical. It's not as pricey as if you were doing it in the hospital or at the surgery center. Of course, I still do many cases at the surgery center or at the hospital setting, depending on the patient and depending on what we're going to do. But something like a bunion can be done in the office setting in our surgical suite.